CT chest in COVID-19 Part 2. Overview. CT chest in COVID-19 Part 2 will be discussed under the following headings: Introduction, Indications in a suspected case, Indications in a confirmed case, CORADs, 25-point CT severity score, 40-point CT severity score, and when not to do a CT chest. Introduction. In the previous video, we discussed about common CT chest findings in COVID-19 patients. In this video, we will mainly discuss about indications of performing CT chest in suspected and confirmed cases of COVID-19, assessment of likelihood of COVID-19 infection using CORADs, and assessment of severity of lung involvement in COVID-19 using 25 points and 40 points CT severity scores. Please note, the guidelines differ from country to country, hence you are requested to follow your country-specific guidelines. Indications in a suspected case. If patient is RT-PCR negative but has severe acute respiratory infection, if patient is RT-PCR negative but plan to undergo high aerosol generating procedures like bronchoscopy, if there is equivocal CXR pattern, or molecular diagnostic tests are not readily available. Indications in a confirmed case. In hospitalized patients with unexplained deterioration, in hospitalized patients with persistent symptoms to rule out additional diagnosis, in patients under home isolation having high-grade fever or severe cough beyond 5 days of illness, in patients with functional impairment and or hypoxemia after recovery from COVID-19. CORADs. The Dutch Radiological Society developed a standardized assessment scheme for pulmonary involvement of COVID-19. It was called COVID-19 Reporting and Data System, or CORADs. CORADs provides a level of suspicion for pulmonary involvement of COVID-19 based on the features seen at non-contrast CT. If CT reveals normal findings or non-infectious abnormalities, it is labeled as CORADs 1. In such cases, there is no suspicion of COVID-19. If CT reveals abnormalities consistent with infections other than COVID-19, it is labeled as CORADs 2. In such cases, there is low level of suspicion for COVID-19. If CT reveals abnormalities which are equivocal and it is unclear whether COVID-19 is present, it is labeled as CORADs 3. In such cases, there is indeterminate level of suspicion for COVID-19. If CT reveals abnormalities suspicious of COVID-19, it is labeled as CORADs 4. In such cases, there is high level of suspicion for COVID-19. If CT reveals abnormalities typical of COVID-19, it is labeled as CORADs 5. In such cases, there is very high level of suspicion for COVID-19. Finally, CORADs 6 is used for patients who are RT-PCR positive. 25 points CT severity score. The right lung has 3 lobes and the left lung has 2 lobes. Each lobe is given a score of 0 to 5 depending on the extent of anatomic involvement. Score 0 means no involvement, 1 less than 5% involvement, 2 5 to 25% involvement, 3 26 to 50% involvement, 4 51 to 75% involvement, and 5 more than 75% involvement. The resulting global CT score is the sum of each individual lobar score and ranges from 0 to 25. The radiological severity is labeled as mild if score is less than 9, moderate if it is between 9 and 15, and severe if it is more than 15. 40 points CT severity score. It is an adaptation of a method previously used in SARS-CoV-1 to describe ground glass opacity, interstitial opacity, and air trapping. According to the anatomical structure, the 18 segments of both lungs are divided into 20 regions. The lung opacities in all 20 lung regions are subjectively evaluated on chest CT using system, attributing scores of 0, 1, and 2 if parenchymal opacification involves 0%, less than 50%, or more than 50% of each region. The CT severity score is defined as the sum of individual scores in the 20 lung segment regions, which may vary from 0 to 40. A CT severity score of less than 19.5 usually rules out severe or critical disease. When not to do CT chest. CT scan should be used judiciously. It is important to remember two situations when it is not routinely indicated. 1. CT scan should not be routinely done as screening test for COVID-19 in an asymptomatic patient. And 2. CT scan should not be routinely done in mild cases of COVID-19 unless they are at risk of disease progression. Thank you.